Hi there and welcome. My name is Jasmine Wolf. I'm the owner here at POL of Love Dual Services, and today I'm going to be asking a very important question, and that is when you should head to the hospital when you're in labor. So today we're going to be discussing a typical and uncomplicated pregnancy and what to do in those cases. If you do have any complication, definitely talk to your doctor, provider, midwife, or doula specifically to ask what you should do in your case. But in uncomplicated pregnancy, most hospitals will want you to labor at home during early labor and the beginning stages of active labor. This is actually better for physiological reasons and your emotional well-being during early labor. During this early part of your labor, what your body is doing is getting ready for the birth of your baby. Your baby is going to be getting into position, hopefully lowering himself into the pelvis. A hormone called relaxin is flooding through your body and is loosening up all of the ligaments, muscles, and bones in that area of your pelvis and your lower back. In addition, your cervix will do three things. First, it will move position. During pregnancy, your cervix is actually positioned towards the back of your body. So it is actually moves towards the back of your pelvis. In early labor, your cervix will first move forward or anteriorly, and then your cervix will begin to efface, meaning it will begin to thin and soften. After that, your cervix will begin to dilate, and this all happens during the early stages of active labor. It is recommended most hospitals that you come during the 4-1-1 rule. What this rule means is that your contractions are 4 minutes apart, 1 minute long, and that this pattern has been at least going for about 1 hour. After this occurs, make sure you call your hospital, let them know that you are on your way. Usually the nurse or whoever, the receptionist, whoever answers the phone will ask you a couple of questions, making sure that you are ready to go to the hospital. Please note that birth is a very physiological process. It is natural, designed by God, and it is beautiful. The hormones during birth play a crucial role in how your birth even outcomes and in how smooth it goes. When you, as a mom and you're in labor, when you get into that car and you're driving, it doesn't matter how short that drive is, it will flood your body with adrenaline because you're actively moving. You're no longer focusing on baby and pushing and breathing, but you were focusing on, I need to get to the hospital, I need to get there. Because of this, adrenaline is flooding your body. However, during the early stages of labor and during active labor, your body will use this adrenaline to actually stop, halt, or slow down labor because your body sees it as a warning that you are not ready to give birth to your baby. This goes back to times when mothers would need to flee from a predator or something and could not give birth to their baby. However, there is a certain time during labor, and this happens later in active labor and definitely during the transition period, where adrenaline actually helps moms during labor. The adrenaline will help you to push your baby out and to speed up the process. And so timing this is not crucial, but it's also important. Recognizing that your body is ready to go and ready to accept that adrenaline. Timing getting to the hospital can be stressful, especially if this is your first baby and you don't really know how it's going to play out. One thing that I would like to remind all moms is that God has blessed you with an innate ability to realize and to recognize how your labor is going. You have those instincts inside of you. And so always trust your body and trust how you feel, mom. If you have a feeling that labor is going really fast and you just want to get to the hospital, then trust that and tell your doula or your husband to get you there. But if you have a feeling that labor is going slow, that it's nice, then trust your body and don't rush into something that you might regret later. Please know that if you are having certain signs such as excessive bleeding, a fever, or your water has broken for more than 24 hours, then you will need to go to the hospital right away because you might be at risk for an infection or another condition. So I hope this video was beneficial for you in learning when to go to the hospital. Please don't hesitate to reach out with any questions, and remember, God bless.